Hayden is opening for business. This is a wonderful thing that we're sharing with you, and Mayor Steve Griffitts is here with us live to answer your questions. He's going to review some of the plans that are coming out so far that roll out tomorrow on May 1st and going forward. And if we have nothing further from the chamber, Steve, take it away.
Candy, thank you, and thanks to your team for allowing me to be able to come and join you guys. There's so much information going on, so many questions, so many people out of work, so many people trying to figure out how to get their work moving forward. So I thought this would be a good opportunity to kind of lay the groundwork and to answer questions. So I'm happy to do so. The groundwork will be pretty easy. 7 weeks we have been under isolation. So stay at home is coming on the end of its 7th week. My concern early on and continues to be is that we can, economically kill 1,000 people to save 50, and it's a hard balance to be able to move forward with. So I've been on calls daily, trying to get as much information as possible. I can let you know that as of today's date, there are 60 confirmed cases in Kootenai County of 150,000 people. There have been no ventilator, no ICU cases, no deaths. We've had 5 total nights of hospital stay for all those. I guess it's 62 cases now. So for many of us, because we've done what needed to be done, we've been blessed. The cases are nominal. But if you look at, was it worth closing down for 62 cases? I can't answer that. We are where we are. And so the focus today is to answer your questions, to give me the opportunity to review the phase out that the governor's put together. The governor had a call with the mayors yesterday. He had a press conference today. So I'll try to answer as best as I can. And then if there's other questions, I can refer you to the governor's office, but I'll do my best to make sure that we get them answered here. By the way, for the governor's plan, even though I have it in front of me, you can go to rebound.idaho.gov and be able to identify the 4-stage plan and what is done moving forward. So Candy, should I kind of go over that plan now, or would you like me to ask questions? What do you think is the best way to go?
Yes, go ahead and review the plan. And then, folks, if you're live, if you will put your questions into the comments for the Facebook, we'll be able to see them and moderate them back to the mayor.
So one of the questions that I get asked a lot, and I'll go through this, is why doesn't the city of Hayden open itself up for business completely? And the answer is because the governor's decisions by the Constitution supersede anything that I do as a city. So I cannot make the city's guidelines any easier than the governor's. There are times under difficulty, if necessary, that I can make them harder, which is just silly in this case. So if we were under threat by another community that is a hot spot and we wanted to keep people out of the area, then the mayors can identify, probably with the approval of the governor, certain tightening of restrictions. But I can't change, as much as I would like to in some instances, change the criteria that the governor has set up. So when you go to rebound.idaho.gov, the first 2 pages are the criteria that is set up so that the governor hopes that we can move this thing forward. Tomorrow is the first day of stage 1. 90% of you should be open for business tomorrow. And that's based on your call. Business should be open based upon social distancing requirements and health requirements. But unless you're specifically identified as one of the businesses in the later stages, then you should have the opportunity under this plan to be able to open business. So that's the first thing. If you're a retail operation, and you're not identified as a restaurant, you're not identified as a theater, you're not identified as a, whatever the situation is in the other stages, then you should be able to be open for business tomorrow. You can, as a business owner, dictate how you want people to be able to interface with you. For example, Costco has identified that now whenever I go to Costco, I'm going to wear a mask. And the mask can be just a very simple one. From what I understand, it needs to cover nose and mouth, and I am not a doctor. I do not play one on television. So, but from what I understand, the mask really protects other people more than it does us. So the criteria is set up so that we hope that we will not see a spike in coronavirus cases. The concern that the governor has is if that spike exceeds our capability from a medical standpoint, then we're in trouble. But right now, just to let you all know, that is not the case. We have the capability to be able to take care of a normal trend, 1 or 2 cases a day. Moving forward, like I said, we've had no ventilator needs or ICU needs so far. It doesn't mean that we won't. Also, I get questions as we move forward as to, okay, can I allow Washington people to come in and be my clients? And the issue from the governor's office is anybody coming in to use our facilities needs to be quarantined for 14 days if they're not Idaho citizens. But if they're coming in for work, not a problem. If they own businesses, not a problem. And in some cases, if in fact they're just going to use your services, they just need to be obedient and then shouldn't stay very long and head home. So stage 1 is 90% of you. And I'll be happy to answer questions later as to, how that works. But you should make sure that your employees are protected. You should continue to maintain 6-foot physical distancing. You can need to provide adequate sanitation. All those staging options are listed on page 4, all those protocols. If you're, for example, as we move forward, there are certain types of businesses in stage 1 that I'll identify that are not yet open. Bars and nightclubs are not open now. Visits to senior living facilities are not available. Visits to jails and correction institutions are prohibited. Restaurants will continue for the next 2 weeks to provide takeout and delivery. However, if you're a restaurant, you need to be able to put together a plan that is approved by Panhandle Health, which will allow you the opportunity to be able to open in 2 weeks. So 2 weeks from now, restaurants should be able to be open for business based upon the protocols and criteria that we have for health purposes. Places of worship, develop plans for reopening and the ability to meet protocols. If that's the case, then places of worship are ready to go. Indoor gyms and recreation facilities are closed at this time, but the opportunity is available to be able to move them forward. And I've talked to Gary and others in some cases. Hair salons, the same. They'll be in future stages. Large venues such as movie theaters are presently closed. They're part of stage 4. And it's a hard one because, Mike from Hayden Cinema has been doing everything he can to stay open. His venues are smaller than most other theaters, but I haven't been able to identify an option whereby he can be listed differently. So again, moving forward in 2 weeks with stage 2, bars and nightclubs will still remain closed. Restaurant dining rooms should be able to be open, and indoor gyms should be open if they have met certain protocols. So 2 weeks from now, stage 2, and let's anticipate that there's no spikes. I'm sure there's going to be more issues, but in terms of stage 2, restaurants will be able to go open for business. Gyms and recreation facilities will be open. Hair salons will be open, and large venues still will be closed. So, and then visited to senior living facilities and jails and corrections will be limited. So we want to be able to move forward to stage 2 and just hope that we can figure out a plan that makes sense. It's an interesting time. Stage 3, bars and nightclubs will remain closed. Large venues will remain closed. Senior living facilities and jails and corrections visits will remain closed. But all other businesses should be able to be open by stage 3.
And what date is that?
And that will be, stage 3 will be then in 3 weeks or 4 weeks. So stage 1 begins tomorrow. Stage 2 begins in 2 weeks, and stage 3 begins 2 weeks from stage 2. The reason for that is you probably know better than I, is it takes 2 weeks for us to see what the effects will be by opening businesses for stage 1. So the biggest variable is we open tomorrow for business. 90% of our businesses are open. We want to see what health, well, they want to see, it's not me, trust me. They want to see what, if that affects our number of cases, and if those cases need to be taken care of through either ventilators or other types of testing or ICU. And we want to keep our capacities, at a good level. The governor, by the way, is not treating North Idaho differently than Southern Idaho. He is not treating one county differently than another. He's treating all areas in the state the same. So stage 4, just to let you know, and you can go to this sheet, it's 9 pages long. Bars and nightclubs may operate in stage 4. So again, stage 4 is 6 weeks from now. The beginning of stage 4 is in 6 weeks. Large venues will be open under limited physical distancing protocols. Bars and nightclubs may operate with diminished standing room occupancy, and senior living facilities and jail and corrections visits can resume. It's really that simple. If your business, again, I've told people, if your business is not listed specifically at either stage 4, stage 3, stage 2, then tomorrow you should be open for business.
Yes.
I hope that helps. Go ahead, Candy.
So should some of the businesses that have waiting rooms, they've brought this up to me. Let's say that you're a bank, a credit union, we'll say a facility that has a waiting room. Should they take extra precautions until we get the fully open to slow things down?
Great question. Some of the doctors, and I've talked to many, are having their patients not wait in the waiting room, but wait in the car. Mm-hmm. And then they're calling them in. So many of them are also doing telework with respect to that. That's a great question. Use your best judgment. And that's going to be the answer to a lot of our cases. You don't want a lot of people congregating together if you can help it. And what will be really interesting for your businesses, I believe, is that people are going to be reluctant to come out. We've been waiting so much to get things back to normal. I don't know what normal is going to be or look like, but there are people now that have appointments to see doctors that have canceled the appointments and said they're not comfortable going outside yet. They're not comfortable getting involved in the normal activities that we would think of as being part of what we do. So that's a great question.
Yes. And another question that we had going forward is if a business has, for instance, we'll say Costco, if a business has required that they have a mask, does that business also have to provide a mask if a person shows up? Or
no, it's an interest, not that I know of. And also from a liability standpoint, if a business opens and let's say that Candy, you come into my business and you can prove that you contracted the coronavirus in my business, I don't know that I'm protected yet from a liability standpoint. That question's not been answered. And it's something that I know many of the doctors are concerned with because they're seeing sick people. But again, we as a business owner, it's your call. You do not have to provide them. I would find easy masks. There's masks that are available My wife made some for the grandkids and the kids and me just out of cloth, but there's other ones available. It's your call, but I wouldn't suggest reusing masks, giving them to Candy and then taking them back and giving them to somebody else. So that's a great question, by the way. Any health related, just call Panhandle Health District, and they've got a hotline set up, but just call them directly. And I can give the hotline. It's probably good to share. It's 877-415-5225. It was manned 24 hours a day, but there's no need to. But that COVID-19 hotline is available, and many of the health questions are answered by them. But the liability question was one that I had asked, and we do not have an answer for yet. So.
I'm going to go to the questions that have been coming in. We have one that said, I received a package randomly from China with a mask in it addressed to my husband. I turned it to the postal investigators. I live in Hayden. Not sure if anyone else has received something like this.
We have not had any reports of anything like that. We've had reports of emails that are coming in. There's a lot of fraud going on right now with respect to COVID-19. There's a lot of fraud with respect to the stimulus payment that people are receiving. So if we got a package that I didn't order from China, I probably wouldn't open it. If we got a package from any country, I probably wouldn't open it and turn it in. Just turn it back to the post office.
Yes. Next question. Are you enforcing the stages of opening? What happens if a business opens 2 weeks before the stage they were supposed to be opening at?
Great question. Governor Little addressed that and just said, please don't. So from an enforcement standpoint, the first thing the sheriff's going to do is go in and educate and just say, here's the situation, here's the stages, here's where you fit into that stage. Please follow that. The next time Ben Wolfinger said he will move forward and just educate again and say, guys, we need to follow this pattern. So enforcement's going to be way down on the list, but just know that your competitors, many of your clients, and everybody in the neighborhood is going to be taking pictures of you and wondering if it's okay for you to be open. So peer pressure is amazing. But from an enforcement standpoint, I hope we never have to enforce anything. We want people to do what needs to be done. So I would go to the stages, identify where I am, and plan accordingly.
Okay. Next question. Where can we find masks to purchase?
Great question. I don't know the answer to that, but Panhandle might know. And if they don't, they should give us direction. I know N95s are different than other masks, so you can go online and purchase other masks. N95s are hard to find. They're a more medical related mask. But online masks should be easy to be able to find and purchase. And I don't know, you could call Lowe's. I'm not endorsing any business, but Home Depot, Lowe's have had those. I know that there's many more in stock now than there were a week ago. So,
okay. And then Kim would like to know, when can we expect a plan or protocols for my restaurant opening from Panhandle Health?
Great question, Kim. So I met with one restaurant owner yesterday. I called Panhandle Health directly with the owner with me. We found out who the individual was that was working with his restaurant and got in contact with them. It should be immediate, by immediate, a day or two. I mean, if the plan is in place, the plan should be fairly detailed but simple. It shouldn't be 4 pages. It should be, we're open from this time to this time. Our chairs are set up for this and for this. If people want to sit together, by the way, they have the right to. So if Candy and I want to go in to Kim's restaurant, we can sit together, even though we're not family, because we're adults and we're going to take that risk, whatever that might be. So, but for people that are coming in separately that want to be able to be spaced appropriately, just space them as best as we can within 6 feet. But a great question. And so I'm hoping that Panhandle Health has told us that they'll get everything moving forward. They understand these stages. So earlier the better, get it in, get it approved. Because, and I would really like to know if Panhandle Health is not responding to your needs. I expect them to, but if you've worked with them for a week and you're worried about being able to open, according to the governor's information, if you just call City Hall, let Brett Boyer know, or Abby, they'll let me know, or you can, if you've got my contact information, let me know, and we'll directly call Panhandle Health, because they don't need to be the bottleneck. We have to get approval from them, but we need to be able to move forward. So.
And then another burning question that's been popular lately is yard sales. What category does yard sales fall in these guidelines? Because we didn't see it in there.
And if it's not in there, then yard sales are phase one. Okay. So do what you need to do. If it's not listed, just go forward and have a yard sale. Be as careful as you can be. Outside is really nice. So just, I don't want to, we shouldn't create conflict, but Ben has been very good about understanding if we have a yard sale, just try to space appropriately. But tomorrow, if yard sales are not listed because they are one of the non-essential businesses or activities that are now approved. So. Okay.
Kimberly would like to make a comment. There is someone in Hayden on Miles that is giving away free masks toward Avondale from 95.
Yeah, if you go, and they had some extras and it's been great.
Okay.
Thank you, Kimberly.
Tamara says, should I cancel my orders coming in from China that I ordered 2 months ago? Are they being held up by customs?
Great question. Don't know the answer to that because there's a lot of good product coming in from China. I don't know. It's just and my comment, Tamara, was if I didn't order something, it showed up on my doorstep, whether it's China or anybody else, I'd be concerned if I didn't order it. But if you've got orders coming in from China, China's processing, as far as I know, from an economic standpoint, as well as we can expect. And I don't think there's anything being held up by United States Customs as long as it meets normal freight and billing information. You should be able to get it. I don't think that you need to cancel any orders.
Okay. We have a good comment from Jessica. She says, non-medical grade masks are available through Creative Costuming and Designs Incorporated. They used to make stuff for performing arts groups, and during this time they're making non-medical grade masks. They have kid sizes as well, and they donate to agencies and organizations whenever one is purchased.
Super. That I did not know, so it's nice to learn stuff. Okay. Thank you.
Rick comment, he said, thank you, Mayor. I'm getting more information from you today than any of Brad Little's press conference. I've watched them all.
Thank you, Rick. You're kind.
Mm-hmm. And then Shannon says, hi, Mayor Griffitts. I had a restaurant owner call today asking what the difference is between a bar/tavern and a restaurant that has a bar area. Do you have any direction on what they need to do pertaining the bar area?
I do. A restaurant that serves drinks is a restaurant. The fact that they have a bar in the facility does not make it a bar or a tavern. But you still need to be able to identify, and we did this with the one business, just making sure that they're spacing correctly. But a restaurant, if a restaurant's main focus is food, restaurant should be open. If they have a liquor license and they serve drinks, those drinks should be served with the same level of protocols that they would with their restaurant. So it's separate than simply a bar or tavern. I hope that answered the question, because that's a tough one to be able to identify and separate. But what we understand now is a restaurant that does serve liquor is a restaurant. It's not considered a bar. So you don't have to close the bar side of your business until bars are open up. Just make sure that you don't have people sitting next to each other at the bar, that protocols are followed.
Okay.
I hope that answered the question.
And Christy would like to know, any word on unemployment? It's been 5 weeks and no money.
Yes, from the governor's calls. That's a great question. So let's see if I have the information. The governor has the Department of Labor director give us information, and we were told. So I'm going to give you a little bit more data and then answer the question. 70 days ago, we were at an unemployment level that was hugely low, and so staffing at the Department of Labor was consistent with the fact that there weren't a lot of needs associated with unemployment. Obviously, that changed dramatically, and we have more than 100,000 unemployment claims. So the Department of Labor has been hiring people. There was a delay in getting the checks out, but I was told last week, so that would have been, today's Thursday, so a week ago, that checks were going out on that Monday. So it would have been this Monday. And I don't know, I have not verified that that's true or not, but I can tell you, if I didn't get any unemployment and I had filed, because I know the filings happened weeks ago, I'd call Department of Labor. I don't know that you could talk to anyone. I mean, I hope you can, but I will have Abby Sanchez and Brett Boyer, I think Brett's on the phone, just to validate how we're doing on unemployment. And Candy, if you could call the Department of Labor as well, we'll figure out if we can tandem that. If we can get it from our side or you can get it from yours. And Brett, maybe we can go through the Association of Idaho Cities. But at some point, I would like to verify that those unemployment checks are coming. So. Okay.
And then Jessica commented about the mask. She said that company had donated to special needs recreation last week.
Perfect. Perfect. Thanks for that update.
Yes. And we're at the end of our questions right now.
Well, I wanted all of you to get a face. This is tragic. This isn't, I hope you're writing in your journals. This is something that none of us have experienced in our lives. Unless we lived through the 1918 flu pandemic, and we'd be pretty old at this point. None of us could have prepared for this, especially when, you're trying to take care of your family. I don't know, you're a senior in high school and it's devastating. You're not going to have a graduation. You're not going to have those activities. There's so much that has happened that has been devastating. I can tell you from our standpoint that I get frustrated one day, then I get new information and I get hopeful. Then the next day I get frustrated, and the next day I get hopeful. So there's a huge array of emotion. But it's important that we understand, I want this thing to open as soon as we can. I believe that as we test more, we'll have more cases. That's just statistics. But I believe that what we've done is tempered the amount of coronavirus in our community. For those that pray, I give this direction a lot. It's out of our hands. This is something that I don't know that man can fix, but pray for the virus to be tempered. Please pray for the healthcare workers and first responders. And it's okay to pray for our economy. It's okay to ask whomever you pray to bless our economy, because our economy will allow all of us to take care of our families. This isn't a greed situation. We're on the earth. We have families to take care of, and we've been put in a position where we can't take care of those families. I can tell you that we know of difficult situations with people that have been at stay at home. We hope you're treating your spouses and children with love and kindness. There's been other issues that have happened because of stay at home, but overall, I cannot thank the people of Hayden enough. This is a very, very difficult, hard time for everybody, and I'm proud of you. I'm proud to represent you. I'm proud to be able to say where I'm from as we discuss some of the things that are going on throughout the state. So I hope that helps.
Yes. And Jennifer Rada would like to say thank you, Mayor Griffitts. We're blessed to have you as our mayor, and we at the chamber agree with that as well. And Valerie says thank you for all you do. She moved here 2 years ago, and she says it's a beautiful place to be at Idaho. Brad says thank you, thank you. We do have a couple last questions here.
Sure.
Are there enough tests for the whole community when we get tests, and who would be giving them and where?
That's going to go through Panhandle Health. And I don't know, Brad Little or Governor Little and Jepson, Dr. Jepson, who's kind of his state health expert, is saying that they want to address more testing and tracing. I'll let them figure that one out on my own. I don't know. I believe that many more of us have been exposed to this. If you feel like you need to get tested, you could go get tested now. I don't know how large the expansion will be from the testing process. I know that we have adequate testing now, adequate facilities to be able to test. I know testing has been changed in terms of protocol and process from early on. Some of our tests are being sent to the Mayo Clinic to be able to be analyzed, and that was coming faster than the labs in Idaho. I know that that's been upgraded and changed as well, but I don't know what the number of tests are right now. We have not reached our limit. So if you feel like you need to be tested, be tested. You can go online and figure out what those symptoms are going to be. And please, again, it's 877-415-5225 is the Panhandle Health COVID-19 hotline. Call it. Do what you need to do. And I have a note here that from our standpoint, one of the things that's going to be hard for you as employers and employees is your children don't have school to go to. Daycare is going to be looked at and organized through different activities or different venues. You can call the Kroc Center for help. I think most daycares are open, and in fact, they're probably full. But schools, it doesn't look like, and that's not my call, but it doesn't look like schools will be open for the remainder of the year. I hate to even say that out loud, because who thought a month ago that we'd be saying that? So, but take care, make sure you understand and are flexible with your employees and their needs. I believe we're all trying to figure out how to get through this darn thing, and listen to your heart, listen to your spirit. If your employees need time to go pick up their kids or take them off, do what needs to be done. And employees don't take advantage, and employers don't take advantage. We'll figure this thing out, but it is amazing how we've grown to appreciate our families a little more by being around them. And we appreciate teachers a little more in schools. So
we did have a question. If Crush the Curve will be available in our area regarding the testing, and also, do you know what the cost of the testing is?
I'll go the last one first. From what we understand, the cost of testing is free. There's been a lot of individual businesses, insurance companies, federal programs, and state programs that will allow that testing to be free. And I don't know if Crush the Curve is going to be available in our area soon, only because I think we're already moving in many of those directions, having those activities. So I don't know that the specific Crush the Curve program is going to be moving forward to our area, because we're handling things as well as needed. I can tell you as well that 100-bed facility was set up at the fairgrounds early on because of the manner in which the emergency operations group was working with this. I mean, if you've ever want to get a testimony of an amazing group of people working together, these folks have tested and worked scenarios before, and when this hit, they hit hard. So Chris Way, Ben Wolfinger are co-chairs of that group, but we were in such good shape organizationally that a 100-bed hospital was set up at the fairgrounds to take care of issues because we didn't know if there was going to be a spike or not, and there's been nothing, so they just took down the beds and moved them to wherever they're needed. But I don't have the specific answer for Crush the Curve, but I do know that there are ample opportunities for A, to be tested, B, to be taken care of. We have enough PPEs, we have enough equipment to be able to take care of those that are sick and are in need.
Okay. And we just had Jeff that said he was just joining. He was asking about restaurants reopening and such. Is this recorded for later? I believe it is.
I can, but if
Let's address it again. Mm-hmm.
Tell them stage 2 and to call Panhandle Health to get your plan approved. You need to have a plan. But in 2 weeks, was it Jeff? In 2 weeks, Jeff should be able to open his restaurant. And there's going to be certain protocols, 6 feet. It's going to be hard to eat with masks on, but certain protocols need to be approved by Panhandle Health District. So call your Panhandle Health District individuals that you normally work with. If not, just call them directly. Let them know who you are. And if we have issues, let Candy, you're going to work on your end and We'll work on ours, because we don't want Panhandle Health to be the bottleneck, and I don't anticipate them doing it. So,
okay.
Be nice to nurses and doctors. I know that mentally they've been on edge because they've been ready to work. Just be nice. And I know that this sounds bad, or sounds like something that we shouldn't announce, but just be nice to people.
Yes.
Help them to smile. Help them. The reason I wanted to be with you folks today is I wanted to be able to allow you some level of knowledge and peace. We're in pretty good shape, and I wish and hope that people's lives aren't devastated permanently because of what we've had to go through. But anyway, smile as best we can and wear a mask at Costco.
Yes.
Andy, any other questions?
I'm good. Everybody's saying thank you. Mm-hmm.
Well, thank you all. Have a good day.
Thank you.
See you later. Bye-bye.